We're shedding light on one of the deadliest mental illnesses in the U.S. We're talking about eating disorders.
Yeah, it's a disorder that has risen astronomically since the start of the pandemic. Chris Holmstrom joining us now on why that is and how to get help for yourself or a loved one if you're struggling with this.
The numbers are just staggering, especially when you hear what it is. I mean, a lot of people are facing eating disorders. In fact, recent data shows that more than 28 million people are affected. Now, these are disorders that you may not even be able to tell that someone has, but it affects that person's everyday living. We're talking their overall health.
I lost 25 pounds in only 30 days.
We've seen them all over social media.
I heard you can lose 10 pounds in a week. Or
videos of people telling you how to lose weight quickly. Oftentimes, it comes at a price.
I was probably 14 when I realized I had an eating disorder. I had actually passed out at school.
Julia Cassidy has been in recovery from her eating disorder for nearly 25 years. She says her poor body image all started when she was a little girl.
I didn't have any specific traumas, to be honest. It was that doctor's appointment when the doctor poked at my stomach, 9 years old, and told me I was chubby, and then he kind of giggled. I was embarrassed and humiliated.
From then on, she was extremely self-conscious, but the issue got worse at 14. She says she was known as the chubby friend and wanted to change that, so she started restricting what she ate and over-exercising.
My eating disorder brain felt accomplished. I felt good because I was able to restrict all day. I was eating just enough. I was winning, so to speak. In hindsight, I felt terrible. I had constant headaches, constant stomach aches. I was really irritable.
Once her parents became aware, they made sure she maintained a healthy weight. Then, at 19, she relapsed.
So there was all these things kind of happening, and I was controlling them through restricting and over-exercising. I would work out 2 or 3 times a day, multiple times a day, for hours on end.
At the time, Julia was studying to become a dietitian.
And it wasn't until I was in some of my nutrition classes, A, when I learned out really more about eating disorders, and B, how what I was doing was actually more harmful than helpful.
Decades later, Julia is a survivor and is a lead dietitian at Alsana Eating Disorders and Treatment Center.
Yeah, first and foremost, you are not alone.
Dr. Taft Parsons is Chief Psychiatric Officer at CVS Health. He says the cause of eating disorders is complex, but that genes and social factors can increase your risk. Risks include malnutrition, impaired cognition, digestion problems, and sometimes death. What's even more alarming is eating disorder rates have risen 70% since the pandemic.
People were very isolated, and so they tended to rely on, number one, the internet, number two, they were alone and a lot of times in those stressful situations without a different way to cope with it. And so a number of people, started to engage in disordered eating that then developed into an eating disorder.
According to research by JAMA Pediatrics, adolescent boys are just as likely as teenage girls to engage in disordered eating. And as Dr. Parsons says, that could develop into an eating disorder.
There are different groups of folks where, people will engage in behaviors that look like an eating disorder. So you have a lot of kind of people that are in dance, gymnastics, wrestling, boxing, all these different areas of athletics where people may engage in, either restricting calories to cut weight, to maintain a certain body type that's thought to be advantageous for the activity.
And for others, they may just be trying to fit in with unhealthy societal pressures. But Dr. Parsons says if parents are suspicious, there are signs to look out for.
Look for significant changes in your child's eating behaviors, either with really restricting the total amount of food, going away from whole categories of food or things that they used to eat, significant increases in exercise to the point that they're getting dehydrated or losing weight.
Oftentimes, eating disorders can go undetected, and people struggle for years, just like Julia. But she wants people to know that there is help out there, and with help comes hope.
My best advice is seek out the help. It's hard. You may feel ashamed or embarrassed, but at the end of the day, I'd much rather you feel ashamed and embarrassed and not feel that internal pain and whatever is happening inside that you're using the eating disorder to cope with.
Yeah, I'm so glad that Julia told her story. So I asked her, 25 years later, how does she still do it? She says she still struggles, but she does some things. She gets in her walk. She takes time for herself, deep breathing, and she doesn't hold anything in. She saw therapy, she communicates, and gets all out of her traumas that she experienced. So
it's a real thing.
It really is.
Like that doctor, adults sometimes do not realize what they're doing that can push someone over the edge.
Yeah, I mean, what, 9 years old, and the doctor
and your body's changing.
Right.
Yeah.
So that's a good reminder for
Doctor
parents.
chubby at that age.
Not what you want to hear.
No.
But I'm glad she talked to us. Obviously, there's
Yeah.
resources for you to get help because this could be a life or death situation. So
very much so. Glad she shared her story. There's a lot of people going through that.
I hope everybody loves themselves a little bit
I know.
harder
Love
today.
yourself in whatever form, shape, and size.
Exactly.